Dr. Heather Smith, and tonight I'm here with some of my amazing colleagues, Dr. Ashley Smith, Dr. Amy Jacobsen, and Lindsey Murray. And we are 4 psychologists in the Kansas City area, and we specialize in anxiety, OCD, and related conditions. And tonight we're talking about some of the challenges that we all face with mental health during this pandemic. And we specialize in anxiety, so we've done a lot of talking about anxiety, and that's certainly increased for a lot of people during this time. But there are some other emotions that people are feeling as well. And I think one of them that is very primary is grief. We have all lost things during this time. We've lost our typical routines. I know a lot of high school and college seniors are really upset about losing kind of these milestones and traditions that they feel like are once in a lifetime experiences. And then other people are facing even more significant grief, loss of job, loss of family members, loss of health. And I think, grief is something that everybody is feeling on some level. So I think it's an important topic that we address.
Absolutely. Heather, I think it is really important to acknowledge that this is a great sense of loss, and what we're grieving over may be different. And I think there's a lot of facets that are worth talking about in this topic. And one of them that I hear is that people are saying things like, oh, but compared to others, I shouldn't feel that bad, or I don't have a right to feel that way. And I think when it comes to comparing pain, it's not an objective measure. You hurt and someone else hurts. It's not a zero sum where there's only enough pain to go around. We need to take the time to acknowledge, yes, I lost this. And it might be something small, like an event you were really looking forward to. It might be something huge, like someone you love. But it's important, I think, to acknowledge how you actually feel. And then we can talk about coping, and that doesn't mean not feeling it. Bottom line is you have to acknowledge, this is what's coming up, this is what I'm experiencing, and grief is the natural experience when you lose something.
Yes. And one of the strategies that we can use, perhaps even to a degree an antidote to grief, is self-compassion. Being able to offer validation to ourselves, to say it's okay that this is hard, and to be able to talk to ourselves as we talk to those we love dearly. If we can talk to ourselves in a very compassionate way and validate how we feel and what we're going through, then that can give us a little boost, to keep going, kind of move toward the next day, move toward the things that we value most in our lives. So being able to recognize that, let ourselves, really acknowledge and allow those feelings to be a part of our experience, and be able to say, it's okay that this hurts. It's natural. I am experiencing what other people are experiencing right now. We're not alone in this experience.
Mm-hmm.
And along those lines, recognizing that day to day, we're going to feel differently, and we are going to have those days that are just harder, and they may be followed by really awesome ones. But just because then the next day feels hard doesn't mean there's something wrong with us. That this is not a situation, that any of us have practice in dealing with, and the emotions that come along with it are also, in many cases, not emotions we've had practice in dealing with. So giving ourselves that grace to feel what we're feeling, and recognizing when when that feeling maybe gets too big and we need to learn how to manage it. There are some skills that we can use to do that. And I think the self-compassion is one of them. And sort of turning toward some of the value areas in our lives that bring on positive mood and make us feel grateful are important too.
I think as we're talking about grief, and then I think about, very closely related sometimes sadness or even depression, which also comes a lot when we lose something that we care about. Sadness is a natural response to that. So I think we need to acknowledge that is the reality of our experience. It's not the totality of it, though, but I think, what we're kind of getting at it is a skill that we call acceptance in the psychology world. And I would love to hear how you guys explain it, but to me, it's acknowledging things as they actually are without trying to shove them away or change them or get rid of them. it's that whole "it is what it is" saying. And I think that this time in particular, because there are so many complex emotions that are coming up, it's really important for us to be able to acknowledge them, to allow ourselves to feel them, but not to spiral downward or not to push against them. That we can say, I am really sad, and today I'm still going to go on a walk. That's what I plan to do. And I'm grieving the event I was really looking forward to, or the experience I was looking forward to. And I'm going to take a moment and smell the flowers because they're blooming today and they're beautiful. So we can have this really authentic, feel what's coming up, even when it's painful, and use skills like self-compassion and resiliency and gratitude to help buoy us through it.
Yeah, I love that, Ashley. And I think you gave, a beautiful description of what acceptance is. It's, when pain comes up or painful feelings come up, we want to experience them for what they are. And it is what it is a great way to kind of think about that. Sometimes I'll tell people, like, what are the facts, right? And there's this great illustration that I really love of a rain cloud. And on one side it says acceptance, and on the other side it says non-acceptance. And on the non-acceptance side it says, like, I can't believe it's raining. My plans are ruined. This isn't fair. It always rains. I have nothing to do. And there's all these kind of judgments attached to it. And on the other side, on the acceptance side, it says, yep, like, yep, it's raining.
Period.
Yes. And I actually use that period sometimes with the people I work with. I kind of say, like, it is raining, period, And so you can use that even when you're feeling those sad emotions. Like, I am really disappointed that my event was canceled, period. I can't change that right now, period.
Mm-hmm.
Something that might make me feel a little bit better is smelling the flowers, calling a friend, and redirecting yourself towards those values.
I love the mental period.
Yeah.
I use that one a lot. And not just when it comes to, I know we're focusing on grief and acceptance and this one, but also to right size worries. These are the facts, period. And not to kind of add and let things sort of spiral down by adding all of that commentary or noise or judgments that comes in. So I think that can be a really helpful strategy.
Right. I think one thing that comes up with the topic of acceptance is the idea that acceptance must mean that everything's okay, or that we have to just accept that it's fine. That's not what acceptance is, though. And so that's a common conversation I have with my patients, that acceptance doesn't mean that we're totally okay with it. It just means that we are allowing that to be a part of our experience. We are acknowledging, kind of going back to some of that language that you guys have used, we're acknowledging that this exists. We're not saying, oh, I'm fine with it, like going to be happy about it necessarily, or that we're going to just kind of raise this white flag and say there's nothing I can do about it. But it's more of an acknowledgement of, this is what's happening. This is a part of my experience right now. And finding a balance within that, using more of a both and kind of talk and language like we're already using today. Kind of, this is happening, and this is the other aspect that I can bring into this moment or this period of time in my life.
I'm glad that you bring up the both and conversation, because I also think with cognitive strategies, we are talking about gratitude and we're always talking about finding the silver lining and all of that. And it's like, well, sometimes that doesn't cover how bad the thing is that we're trying to, find gratitude within. And so I think being able to say, well, this is true, but also this is true. And we're working to kind of find how we can marry these and merge these two feelings together and experiences together so that we're experiencing the situation in a way that feels manageable to us, right? So we're all living in this really difficult time, and we have sort of a decision to make in how we're going to experience it. And if we let just the negative part of that run the show, then of course we're going to be feeling that grief really substantially and fall into sort of that spiral of depression. So I think we do have to sort of work a little harder right now to find the other side of that. And I'm telling my patients too that, like, that's okay. You know, we all are having to work a little bit harder in this moment, and that doesn't mean there's anything wrong with you. And it doesn't mean that the person next door isn't also having to do that just because you aren't observing them having to kind of put forth that effort.
I love those points that you're bringing up, Lindsey, because it's not about like being positive. I love the pandemic. No, that's not true. And yet we can say it's that finding something to be grateful or appreciative of, or practicing some compassion. The lady who was yelling at the grocery store to everyone to back up. Okay, it's easy to judge, or I can look at, she's probably really scared, right? So we can have some compassion for ourselves and for other people, but that's a choice we get to make. And so I love what you're getting at too, that in this, and with a lot of it that's out of our control and a lot of really horrible and horrific things happening, we still get to choose who we want to be and how we want to be with grief, with sadness, with depression, with fear, with loss, with everything. And I think that's kind of empowering in a way, and which I think is also really important when we feel like we don't have a lot of power and control. So as we're talking about grief and loss and acceptance, I think it's also important to note that a lot of people are experiencing depression maybe for the first time, or a worsening of symptoms for a number of reasons. And there is help still out there. If you're suicidal, if you're having thoughts of self-harm, or you're feeling really hopeless, there's the 24-hour, 7 days a week suicide hotline. I want to get the number for you. It's 1-800-273-8255. Please don't hesitate to call.